Good evening, viewer. Welcome to our Glory Globe TV. Here is the most amazing news for our viewer. Semaglutide reduces the need for loop diuretic use and dose and has positive effects on symptoms, physical limitation and body weight in patient with heart failure with preserved ejection fraction regardless of diuretic use according to late-breaking research presented May 13 at Heart Failure 2024, a scientific congress of the European Society of Cardiology. HPQEF is a condition in which the heart pumps normally but is too stiff to fill properly, rendering the heart unable to support the body's need for oxygen-rich blood. The condition is becoming more common as populations age and levels of obesity and sedentary lifestyles rise. Symptoms of HFpEF can include shortness of breath, often with exertion fatigue and swollen ankles. STEP HFpEF and STEP DM trials evaluated once weekly semaglutide treatment versus placebo in patients with obesity related HFpEF without and with diabetes respectively. Both studies showed a significant improvement with semaglutide for heart failure symptoms, physical limitations, weight loss and 6-minute walk distance compared to placebo. Pre-specified analysis of pooled data from the two trials investigated whether the effects of semaglutide versus placebo varied according to baseline diuretic use. In addition, the effects of semaglutide versus placebo on changes in diuretic therapy use and dose during the trials were evaluated. Both trials patients had obesity related HFpEF with left ventricular ejection fraction 45%, body mass index 30 kg per square, Kansas City cardiomyopathy questionnaire clinical summary scores 90% evidence of elevated left ventricular filling pressures, structural heart abnormalities plus elevated diuretic peptides or recent heart failure hospitalization plus structural abnormalities or ongoing need for diuretic therapy. Patients were randomized 1:1 to once weekly semaglutide 2.4 mg or placebo for 52 weeks. The dual primary endpoints were change in KCCQ CSS, a standard measure of heart failure related symptoms and physical limitation, and percentage change in body weight from baseline to 52 weeks. Patients were stratified by baseline diuretic use, non-loop diuretic, only loop diuretic. A total of 1,145 patients were included, 529 in STEP HFpEF and 616 in STEP HFpEF DM from 129 sites across 18 countries in Asia, Europe, North America and South America. The average age was below 70 years and 50% were women. At baseline, 220 patients were not receiving diuretics, 223 were receiving non-loop diuretics only, and 702 were receiving loop diuretics. The first primary endpoint of change in heart failure related symptoms and physical limitations from baselines to 52 weeks, semaglutide improved KCCQ CSS in all diuretic subgroups, but the magnitude of improvement was greater in patients receiving loop diuretics compared to those not on loop diuretics, with an adjusted mean difference versus placebo of plus 9.3%, 95% confidence interval CI plus 6.5 plus 12.1 versus plus 4.7 points plus 1.3 plus 8.2 respectively. P interaction is equal to 0.0042. The second primary endpoint of percentage change in body weight from baseline to 52 weeks, semaglutide had a consistent beneficial effect across diuretic use categories. The adjusted mean difference versus placebo ranged from minus 8.8% to 6.9%. From no diuretics to the highest loop diuretic dose category, P interaction is equal to 0.39. Semaglutide had consistent beneficial effects on all secondary efficacy endpoints, including 6-minute walk distance across diuretic subgroups, that is called P interaction is equal to 0.24 to 0.92. BN Das exclusive report, Glory Globe TV Delhi, Bharat.